This is Deirdre Virvo. Thanks so much on Let's Talk Live. Seniors, memory care issues, Parkinson's, Alzheimer's, and things live. We were started at 5. Get some technical. We're still kind of working out, but people kind of climb. Special guest, Medicaid version. We're going to try our best. So, in a moment, I'll introduce you to Elena Goggin, and is going to deal with myths behind Medicaid, and it's complicated, and just what it is. But I want to tell you, I'm so good. My home house, just home, Dogwood Home, Shelton, which is our 6 senior memory care issues. Today we have furniture, the piano is tuned, we're total to take people on, and we're paying them. Give me, email me, very happy to. I'm taking 16 so fast. Please, give me a call. I want to say this book, Home, I never know where, this step, senior health, and if you would like it for just have you send it, no problem. For today's special guest, Eleanor, and of life care planning, certified Eleanor, and she's more than 30 years. She's about 35 years old, more than 30 years in the legal, insurance, and health care industry. Her financial and insurance, long-term care, community-based program, the back planning, while care management commitment is for clients mind to their family. She is amazing. She's a life caretaker, and she also does assessments. So, like if you have sure, do they have dementia? Where do they stand? Can they get met? Are they able? What do I do if they get does assessment? So definitely want to, and we are introduced right now, and Elena Goggin, thanks for joining us here on, and we're so about your care, your memory, your med versus med, and why don't you start off a little bit about yourself and because complicated.
Is complicated. So just a footnote, we're still having a couple of technical difficulties, so I'm going to do my best to provide you with the best possible content, and I hope that what I'm experiencing on my end isn't transferred over to live. So a little bit about us. I've been working with elders, specifically in these areas, for about 15 years or so. We do care coordination and advocacy, and we manage and oversee care challenges and care management for elders, seniors, and we assist their families in doing that, helping their loved ones. We also are very good at navigating the Title 19 process here in the state of Connecticut and also in Rhode Island. And life care planning happens to be my love, as you know, Deirdre. We help seniors that are proactively looking at their planning long-term. And we also help those seniors that are in maybe hit a speed bump, have an issue one way or another, and we help them navigate their current crisis and then put a plan in place for them so that they know that they are making good choices on a proactive basis that won't tip the cart over down the road, and they won't be quite in such a crisis as many of our early clients have been. So that's a little bit about me and elder life care planning.
Nice.
And it's super. And I think just to make sure that I don't miss anything that Deirdre's saying is, I think that you all want to hear a little bit about the differences between Medicare and Medicaid today. So let me just dive right in and give you a little bit of information, and then we'll see if we can take some more questions from you, Deirdre, if I can hear you okay.
Sure.
Does that sound good?
Yes.
Great. So most people know that Medicare is available to them when they become 65 and older. So it's a benefit that is afforded to them through their Social Security. There are some individuals that aren't actually eligible. So those are people that work with a defined pension program. And a lot of old-time teachers, maybe some firefighters and police officers, they only contributed to their defined benefit program and were eligible for a pension and healthcare benefits through their pension company. So, and most firefighters that I know, I live with one, he's my husband, had a part-time job. And as a result, we're able to put those quarters in through Medicare, through Social Security, and now we're able at 65 to get those benefits. And the reason why Medicare benefits are so important is because, most of our life we're amassing wealth, and we are contributing to our 401k plans. We are saving for retirement in, individual retirement accounts. We're putting a little money away in our savings accounts, so that when we retire, we could pull from those expenses as needed. So the key would be in retirement to not have so many expenses. And Medicare is a beautiful coverage that allows us to get our Part A, which is our hospital coverage, and our Part B, which is our doctors and our testing facilities and our x-rays. All of that is covered under Medicare. We'll usually cover about 80%. And then we get a supplement after that to cover that other 20%. So you get Medicare that covers your hospitals and doctors, and then you get the supplement that will pay the rest of that. And also, obviously, it covers the testing. There's another benefit. It's a Part D benefit that covers your prescriptions. And then the third benefit is for those people that are really fairly healthy or really on a very limited budget, there's a Medicare Advantage plan that offers Medicare benefits without a supplement, and that's called a Part C. So now that I've given you a brief description of all of those services, what's good to know is they will cover very few long-term healthcare challenges. So they'll cover, like I said, your doctor's visits. They'll cover your hospital visits and stays. They'll actually cover your rehab visits up to a certain period of time, but they will not cover long-term care. Oh, I'm sorry. I think someone's having a tough time with this conversation as well. I apologize. Doing my best with what we have here, and if we have to repeat it, we will. So back to the conversation of benefits. Oftentimes what I find seniors having a conversation with me is they often say, I'm all set. I don't have to worry about care if I ever need it. I have Medicare. Unfortunately, that's a fallacy. Medicare will only cover short bursts of care. So when you go from the hospital to a skilled facility or a rehab facility to rehab, and you are anticipating returning home, Medicare will cover some of those days, maybe not all of them. So I usually step in and advocate for as many as possible for our clients. Then when they get home, we're advocating for some services. They're called home health services, so that they'll get assigned a nurse that will assess them. A physical therapist, occupational therapist, and sometimes a speech therapist if needed. You might be able to get a home health aide in there once a week to give you a shower or a bath for a very short period of time, not an indefinite period of time. So the mistake that's made is that most seniors or elders that want to age in place at home think their Medicare benefits will cover the cost of home care, which is different from home health care. Home care is custodial care. Somebody coming in, maybe getting you up in the morning, helping you with your activities of daily living, your bathing, your grooming. Maybe they make you a light breakfast and prepare a sandwich for lunch. Just enough to get you up and at 'em safely. And then they maybe return in the evening and do a little bit more of that. Those are not Medicare covered benefits. Those are private pay benefits. And if you don't have considerable assets or income or any type of financial resources, those benefits, those care costs will eat up your life savings. And that's how people end up applying for Medicaid, because they still want to stay at home, which it's my, true joy to be able to keep as many people home as possible. But those benefits are not covered by Medicare. They are covered by Medicaid. That's an application process. Oftentimes, people will say, well, they came in and they told me that they're going to do the fast track application. There is no fast track, by the way, and we're going to get benefits soon. I always say that if you're ever in a position where your current health costs will eat up your life savings within a year, that's a great time to reach out and have a conversation with someone like myself. Because there are supports that we can put in place to be able to help you navigate not only the Medicaid process and get those benefits and advocate for you to stay at home, but also maybe do some creative planning. And we have a question from someone, do I have to sell your home to get on Medicaid? Oh, it's a brilliant question. Thank you, Deirdre. I believe you must have sent that in. You do not have to sell your home in order to qualify for Medicaid. And if you're in a nursing home, there's something that can be done if your house is still, and you want to get back home. I can't tell you how many people that I was able to get back home from being in a nursing home when they've run out of money completely. So I hope that answered your question. Also, if you want to stay in your home and get care in your home, you absolutely do not have to sell it. They understand that you have to live there. You do have to have the ability to pay your utilities. And if you own your home, taxes and insurance. And again, this is why we tell people, don't call us when you have $5 to your name and now you have to try to figure out this process. There might be something creative that we can do that allows you to stay in your home, even if you don't have the income resources to pay your taxes and insurance. So that's a creative idea that we come up with to be able to help people age in place in their home. Currently, my mom is living in her home, and it's my joy to be able to keep her there. And sometimes there are people that say, my husband passed away or my wife passed away, and the house is so big, I feel a little alone. Could I go into assisted living and still get the care? And absolutely, yes, there is a way to be able to navigate that as well. So I just want to let you know that the possibilities are plentiful, especially if you ask questions early enough and you proactively plan. And again, for those people who are in a crisis mode, that, something just happened out of blue, you were okay until you weren't okay, call anyway, because that's actually where we help most of our clients, because we think we're doing fine, and we are doing fine until we're not doing fine. And then we have to kind of navigate around that. So the big difference I would like to say between Medicare and Medicaid is, well, the only similarity, let me start with that, is the fact that they are government-funded programs, right? So Medicare is funded by Social Security and in the federal government, and Medicaid is state and federally funded, okay? So those are the only similarities. The big, huge difference is making a mistake thinking that I've got Medicare, whether you have Medicare in a supplement or Medicare Advantage plan that includes your Part D program, and no supplement is needed, that will not cover the cost of the kind of care that most elders need as they're aging in place in their home. It will help you with a mild bump in the road, kind of get back on your feet. So recently, my mother last year had an awful slip and fall accident fractured her foot in so many places we can't even describe it. And she was stuck in a long-term care facility for a rehabbing. She was definitely rehabbing. She wasn't there long-term, but she was there for a considerable period of time because although she was wheelchair bound, the wheelchair didn't fit into her home. So we had to keep her there for an extended period of time. It was most of the summer. It was very difficult on her, very difficult on me that I couldn't get her home. And I would never get her home unsafely. I would never get any client of mine or my mother home unsafely. So she toughed it out. She got great care. And then when she was able to transition back home, her Medicare covered benefits helped her with therapies and a shower once a week. And the rest of it we helped her with, right? So again, Medicare will help for small little things and help you transition out of if you're healthy enough, out of one place into another, but it is not a long-term plan for care. I hope that helps. Medicaid is a long-term care for planning, and it's not necessary for everybody to be on Medicaid. But if you have $100,000 or less and you have some health concerns or your loved ones have some health concerns, I say reach out before that money is gone. The thing that I practice all the time, that I preach all the time, I also practice, and that is allowing specialists to help support me. So I also say the same thing. Use that money wisely. Get specialists to help you support your loved one as they're trying to age in place.
So can you hear me, Elena?
I can. How did that go?
Information, but I'm a little about allowed to have and get more or long. Do you have to spend down on Medicaid? And if we do one head, are you planning to our money, keep some? What? Why should we do it in advance?
You're going in now, and I'm going to do my best. I think you're asking. That's okay. This is a translation. So basically, you're absolutely right. There is a send down Medicaid. Years ago, they have 3 levels of care, and I won't go into all of them. One of them was state funded, and that was income driven and a little asset driven. But so you didn't have to spend everything down in order to get some care in the home. So in a pinch, people started there and then transitioned to Medicaid. I like going right into Medicaid, and it's just my preference. I think the funding program is, definitely huge benefit and definitely looks a goal. But people get places with that, and they're like, I've got this. It was very easy, and I'm good to go for now. And then before you know it, they run out of money. Nobody's holding their hand and telling them that they now need to go through the entire process almost all over again. And then they run out of money when you're in your home currently. There is no retroactive coverage for care. If you were in a facility, there would be not home. So back to your question that I think you asked, Deirdre, which is there a spend down Medicaid? And yes, there is. If you are a single individual getting looking for care benefits at home, or you're in a facility and you're running out of money within the year, they only allow you to keep $1,600 or less in your name as an asset. That's not income. That's your asset. That's any money that is left at the end of the month after paying bills, right? And again, you can't really have a home. You come back next week and you too much feedback. Everyone's calling me. Yeah, absolutely.
I'm sorry that this live thing we're here today.
I'm sorry because I was beautifully.
Oh, but this is topic, be able to understand me, and I can't hear what's going on.
Okay, absolutely. I'm going to be delighted to come back. I'm glad we at least need to try, and I'll be back next week. And then whenever you feel you want me to.
Back next week, Elena. We probably all worked out. What happens when you lie? Elena.
You're welcome. Happy birthday to your mama.
No problem. So much. I'm so guys. I hope for me, I'm not. So I'm going to say sayonara, and thank you so much. Sometimes just a little crazy when you're live. I hope to see you tomorrow for talks. So much.
Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who you feel is not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. We're truly a home with only 6 senior residents living as one family unit. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home as it will be only number 6 for Connecticut. Brand new, sparkling clean, opening mid-June. And safe, safe, safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else. Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson's issues. We're only taking 6 residents, so the home will fill up fast. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved one. See you soon. Bye.